Hello, my name is Anthony Foe. I was one of the first participants in the Daniels program from the School of Nursing. I think the thing that stands out in my memory about the program was one of the first workshops when the NP students and the first year med residents did some role play exercises together. This particular exercise that I'm thinking of explored assumptions that doctors had for nurses and vice versa. And something that became clear was that neither group had a good understanding of each other's training or educational backgrounds, and that nurses and doctors might think very differently about how to solve problems. One approach not being better than the other, but sometimes surprising to the other. My sense is that nursing school and med school are essentially siloed operations, in other words, separate universes. Once you go into practice, nurses, nurse practitioners, and doctors are often thrown together and expected to be very efficient and collaborate with each other with a high level of affinity, but not necessarily from a strong vantage point of understanding each other's backgrounds. I think the Daniels program was the first time during my education that I had the opportunity to have a dialogue with physicians directly about our professional relationship. Our often misguided assumptions and stereotypes about one another, and about our training. Finally, it was sort of the first time in the academic setting that I had an opportunity to have a dialogue with physicians on how best to collaborate. Interprofessional collaboration and education has definitely influenced my professional career. After I graduated, I worked in Tanzania developing a training program for emergency nurses. The program that I was developing was part of the first emergency medicine residency program for Tanzania. And the doctors that we were training were the first residents in the country. Neither the doctors nor the nurses had experience with emergency medicine. My experience with the Daniels program definitely influenced my curriculum. I made sure to include a dedicated module on communication and collaboration between the physician and the nursing staff, and I included role play around communication during critical scenarios like codes, but also how doctors might empower nurses to communicate status changes and updates on patients, something that was lacking in the existing culture. Currently, I'm working as a nurse practitioner in internal medicine at Weill Cornell Medical College in New York City, and the majority of my colleagues are physicians. Interprofessional collaboration is definitely a part of my day-to-day with my physician colleagues, and the Daniels program gave me a clear insight into the life, especially of medicine residents. I had the opportunity when I was a nurse practitioner student to round with medicine residents and see patients together. I often think back to those experiences as I work with residents now and what sort of pain they might be going through. I feel very lucky because I work in a very collaborative environment. I co-teach health disparity seminars in our ambulatory care curriculum with one of our faculty physician members, and having experience with IPE definitely helped me as we developed our seminars and to make them engaging for our residents. I think the Daniels program gave me confidence to bring my nursing experience to problem solving and a problem solving approach from a nursing perspective to the medical residents and to help facilitate that collaborative dialogue. In the fall, I'll be starting an adjunct faculty position in the FNP program with NYU, and I know I'll definitely be bringing everything that I've learned about medical resident education at the medical college to the nurse practitioner students. I think really the best way to facilitate interprofessional education is through a combination of problem-based learning and collaborative role play. Very similar to some of the exercises that I learned in the Daniels program. I found this approach to transcend culture in Tanzania, to be relevant here at the Cornell Medical College, and I'm sure it'll work for the FNP students at NYU in the fall. In closing, I'd like to say a word of thanks to Dr. Worth and Mrs. Jane Daniels for making the Daniels Initiative and program possible. Thank you also to Laura Haniak and Kathy Becker for including me in the first group of students that got to participate in this phenomenal experience. I hope you can continue to expand the program to more nursing and medical students. It's truly a unique experience, and I'm sure it will continue to positively shape all of its participants, including myself. Thank you.